one of the main challenges that we currently face, in the medical fraternity itself, is to see how we can incorporate genomics into the mainstream medicine, so personalized medicine actually becomes a reality in the near future. So some of the challenges that we face, the first one that is most important is the knowledge of genomics in the physician population. See, physicians are trained in a completely different skill set, and genomics is an evolved field by itself. So a person can just know everything that is there out there. But since genomics is eventually going to be amalgamated into mainstream medicine, it is very important that we become aware of the changes that are happening in this field, which is quite rapid, and how we can incorporate it. Now, there are a lot of initiatives being taken across the globe. One of them is in the postgraduate training. There is actually an extra year added now for the physicians to be trained in the field of genomics. So that's one thing. The reason we need the knowledge of genomics is, the reason we need it is there are so many genetic tests out there, and we as physicians need to know which one should be ordered so we can make maximum impact for our patient. I think that's one of the things which is currently happening is, most of the times we order a genetic test also based on the price. Go for a cheaper test so it is easier for the patient, let's see what happens. And at the end, when the physician doesn't see value, we end up disregarding it. Maybe genomics is not ready yet, leave it, I'll just do what I'm doing. But here's the thing, yes, at this point, the other problem that we face is the pricing point. But when it initially started in 2003, it used to cost in millions, when all these big shots like Jeff Bezos and the Microsoft CEO, they all got it done. It was very, very expensive. But since then till now, it has drastically slashed. I'm talking about the latest technology, which is called the next-gen sequencing, which gives the maximum genomic output. And that's the main test which will add value for physicians, especially treating disorders in the field of internal medicine and its subspecialties. So we need to be vigilant of that, and once physicians are getting into the practice, once we know more about genomics and know which test to order, we will be able to add value. The other thing that we are seeing is the insurance companies as well. At this time, even when the physician has to order a test, if the patient has to pay a higher price, we sort of back off, like, should we be doing that for the patient? Once insurance companies also understand, the value that precision medicine adds to a patient, because you're doing more of preventative healthcare, you're giving the patient the right medications right from the beginning, so the chances of side effects are less, so the chances that the person would fall sick are much less, which means the person will probably not end up in hospital that frequently. Which means just at that price of that genomic analysis, sequencing, and the data interpretation that you're doing, you are able to avoid much higher healthcare dollars, which can happen when the patient is actually admitted to the hospital. Once that realization hits as well, I think more companies, insurance companies, will jump on board as well, because this significantly adds value to the patient. And I think business aspect as well, and cutting down the costs significantly. So I think these are some of the main challenges. And
of course, and to add to what Dr. Hima said so far, and the most important thing here is, it is a once in a lifetime test. It is not that like a CBC or HbA1c, you have to get it every 6 months to see change it, because you are born with a set of genes and they don't change over time. So it is a once in a lifetime test, and this is something that we need to get it done in the database. So for example, like what we are doing here, so far over the last 3 years, we analyzed about almost some 120 terabytes of data, which is almost more than 20 million variants. And to our not to surprise, actually, there are multiple novel mutations, which mean they are not documented elsewhere in the globe. So we were able to analyze them with the data set that we have, and we, as a part of NIH, and we are part of global community in terms of curating the databases, we are contributing to the science from our end. So we are having our signature in the mother database, which is called w.r.t, which is hosted by government of US, and it is in Stanford University. We are curating continuously every single day. At least we are giving them 10 to 12 variants which are unique to Indian population, so that the next company coming up, if they want to do their analytics, these signatures will be useful, because we don't want to miss out on that data, which is very key. So we are continuously contributing to the science in that way. And the more data we get, it is getting more exciting, because of the interpretation we were able to make. And coming to the question of the acceptance, yes, even as physicians, we do understand and we are trained that for every test there has to be a prescription. It is not going to change slowly, and as we are seeing it day in and day out, that even the patient awareness is much more. So we need to have a holistic approach. So what is the diet of this patient? What are the socioeconomic status of this patient? What are the environmental factors of this patient? What are the genomic data of this patient? Once we put together, we can create a holistic plan, not just to give a prescription and then see how it works. We have to have a holistic approach towards this patient. That is what personalized medicine is all about. So we are going to curate, okay, this is food which suits you. These are the things that you should eat more. These are the medications which suits you well. This is the exercise regimen that you need to follow. So we are providing a way of living more than just giving a prescription. So this personalized medicine is going to evolve as we go forward, and I am hoping that more scientists from and physicians and hospitals and government institutions in India will come together and help to build this data set. And is there anything else that we need to add?
I think as you rightly said, the more data that keeps getting added, especially with the Indian context as well, the curation that we are doing on a daily basis at this point, then like you rightly said, any other genomic company which is coming up in India, they can take the advantage of that and use because anyone who's running bioinformatics, they would have to go to w.r.t database. They can utilize that data to give good reports to their patients. So as a community of genomics and of physicians, I think we can help progress in the direction of personalized medicine.